Hi, I'm John Martini, the Assistant City Manager for External Services here at the City of Sparks, and I'm here today to talk about some exciting news. Our colleagues at UNR recently completed the study of, we studied wastewater to see if we could find the prevalence of the COVID virus in the wastewater in our treatment plants and in our collection system, and in a nutshell, we did. At the very beginning of this COVID outbreak, the City of Sparks met with our colleagues at UNR, Dr. Pagilla, and we were curious about, is it possible here in the Truckee Meadows for us to do environmental surveillance of wastewater so that we could get the data and the information we need to better understand the pandemic and how to manage it? Dr. Pagilla was able to come up with a research program which initially the City of Sparks funded through the CARES Act. Our partners at the City of Reno and at Washoe County joined in this research effort, so it became a regional effort to get the data, to get the information we needed to see how best to manage this pandemic. And the results are remarkable. When you look at the results, you can see the amount of genetic material in the wastewater rise as we hit that spike in October and November and through December and into January. It tracked very well with the results we were seeing from testing. So the amount of COVID we were seeing at the plant lined up pretty well with the amount of people, unfortunately, that we saw getting sick in our community.
The biggest takeaway from measuring the wastewater samples was that it truly reflects the extent of the disease as it was determined by human testing. And second thing is that by doing this type of wastewater monitoring, we can really monitor diseases like this without interrupting people's lives, means not taking samples from them. So, and also include asymptomatic individuals who haven't been tested. So, and we also found that it is somewhat predictive in that people do not get tested until the symptoms show up, whereas the wastewater viral marker concentrations are real time. As soon as a person is infected and they discharge the virus into the waste, that can be seen in the wastewater. So we cannot separate out just the vaccine effect, but overall, if the pandemic is decreasing and the number of cases are going down, that we are able to clearly see through wastewater-based monitoring. So by doing more frequent monitoring, we can really see whether the pandemic is going away or a resurgence is happening. So now we are in a position to do that. The university was able to engage with all the community organizations, City of Sparks, City of Reno, Washoe County Health District, regional planning agencies, and many other people across the university and outside the university, collectively to do a collaborative effort, which was very, very successful in my opinion.
TMWRF is where most of the sewage in the valley ends up, and so it was an obvious place for this sampling event to occur. We saw a very clear spike in the virus coming into the plant approximately 7 days before that spike appeared in the community in the form of people testing positive for the virus. So it is a good leading indicator of what's happening in the community, which was one of the intents of the project from the beginning, was to see if we could establish a correlation like that. Not only did we sample the collection system, but the influent and the effluent, so the water coming in and the water coming out of TMWRF, were both sampled for the COVID virus. And while it was clearly detected in the influent, it was not detected in the effluent. So we can say definitively that the virus does not survive the wastewater plant, and the water going back to the Truckee River is free of the virus.
We are continuing to monitor limited number of samples in the wastewater so that we can keep track of what is happening. And we are even doing more work to look at if there are any variants that is known in the public news now, that there are different variants of the COVID-19 virus, and we are measuring for that through genetic testing of the samples, comparing the variants from human testing specimens and the wastewater specimens as well. So it's really an eye-opening thing, and we are already seeing some really interesting observations.
Environmental surveillance of wastewater is not new. It's been around for a while, but what is new is that we now have the ability to do it at our university. And having this tool in the toolbox up at UNR will help this community for the next pandemic to understand it and to find more efficient and better ways to manage the pandemic.